let's get a brief introduction from you guys. Your positions, how long you have been with United Medical, and what you are going to present today. And then after that, we can start with the presentation.
All right. Well, my name is John Rocco. I've been with United Medical since September 2013, so I think I'm on year 9. I've been with the payment posting department as a level 1 payment poster team lead, and I've been client manager for some time now. I've worked with several employees, and I've been pretty involved with the department overall as far as getting everything converted electronically.
Dora?
Hello, my name is Dora Beasley. I am also a client manager for the payment posting department. I've been with since December of 2014, so this will be my 8th year. We'll just go over some basics of our department, kind of familiarize everyone with what we do and how we do it.
Excellent. And Taryn?
My name is Taryn Marson. I've been at UM for, I think, since August of 2015. So I think that's around almost 7 years now. I'm currently a client manager under the accounts receivable department. And I'll be discussing the SPM eligibility function.
All right, excellent. So what I'll do is just to restart the video from the beginning. I need to just refresh it. All right, well, Jared, you're on.
All right. Thanks again. Our payment posting department is responsible for logging payments into the practice management software. Our daily responsibilities typically involve retrieving, logging, posting, and archiving lockbox and correspondence. 80% of our workflow involves electronic posting. The rest are manual posting and service requests. We also offer special services such as bank reconciliation to our providers. So on slide 2, we focus our attention to the provider and the patient at the center of it all. Our main goal is to make sure that as a team, we give time for the patient and the provider to work together. So once the patient leaves the provider's office and the United Medical System verification and claims are sent out, Dora and I are responsible for establishing some kind of a relationship with different insurances. That's where we come in and enroll electronic deposits and electronic remittances for many payers. We have a relationship with several representatives at Gateway EDI and TriZetto. And once those relationships with the insurance is established with our clearinghouse, the claim will come back, and it'll come back as an 835 file, which is just short for an electronic remittance file. And once the electronic remittance file is received, it's archived in our clearinghouse and downloaded into our practice management system. And from there, the payment posting team will process the remit, build the secondary insurance if there's a secondary policy, and if there's no patient responsibility, we make the appropriate adjustments. And if a claim is not paid, then we pen the charge and make sure that the balance stays right where the AR and billing team can work it. And more into the electronic posting. Our clearinghouse is sort of a massive warehouse where a lot of things go in and a lot of things go out. So Dora and I work with the representatives at TriZetto to make sure that our payment posters will get the appropriate information to post deductibles, co-insurance, insurance claim payments, and we want to make sure that we take note of coordination of benefits, and also establish different sort of accesses to get the information from non-insurance payers, such as like patients, collection departments, and workers' comp representatives. And we manage all of that using our 7-day reporting sheet. We have a team of 12 people in our department, and we meet several times a week to discuss a certain overflow of work and redistribute it that way. And when some people are out, whether it's COVID reasons, sick, vacation, Dora and I work together to redistribute the work that way as well. And I also want to talk about reconciliation. This is our sort of special workflow for providers that give us certain access to their financial information. And what reconciliation is the process of matching what comes in the bank to what goes into the billing software. So technically it makes an internal work queue for our team that way, that we only enter what money they receive and nothing more. This provides valuable information to the provider's accounting teams. It lets us identify if a certain payment is received. In some cases, providers will receive different EFTs, direct deposits into their account, and we may not get the data through our clearinghouse. And that is normal. It's part of our workflow. And what Dora and I will do is work with not only the clearinghouse and insurances, but the online access portion of this so that we can get the information right away and work on developing that relationship with the vendor later on. Sometimes we don't have direct deposit and we anticipate the money to be cleared in the bank account. So we'll have an electronic remit, but the direct deposit relationship is not there with the bank. So we'll see the information and anticipate it there. And that way we can determine what the, what the amount of money is going to come in for this set of physicians. What the reconciliation process does also is it creates a sort of financial safety net for the front office of our providers. So the separation of duties doesn't really need to be so heavily involved since the money is going directly into the bank accounts. And Dora and I are to work directly with our staff so that we make sure all of the payments are going direct to the bank account. Okay, now I talked about direct deposits. I think the other thing I want to talk about is our manual posting workflow. So this is the other side of our non-electronic posting. So if we do not have the relationships with the clearinghouse and the insurances, there are several ways for the explanation of benefits to come back to the providers and our team. And Dora will talk about that later, and we have some slides coming up. But when the claim is accepted, it's sent over to either a PO box, a pay-to address, or it's faxed over by the payer. After this, we post everything manually. It's not as efficient, but it is part of our workflow. And then we archive all of the explanation of benefits, and then we upload it to our database. And whether it's gonna go to the patient, whether it's a collection remit, or it's gonna be something that our billing team will work on, we have different queues where we store and put that into the next workflow. Okay, that's it from me. Dora, do you want to take over the rest?
Sure. So just to kind of,
Just a couple questions, a couple points actually. So I'm just going to bring this. Let's see if that. All right. So, well, Jared, thank you for the really good information. These are stuff that we work every day. Well, interesting enough, as you guys already know, payment posting was one of my full-time responsibilities back in May, June 2000 timeframe. So that was about 22 years ago. So because I'm 29, so that's about I was 7 years old, 7 years old, I guess. So maybe not. So I love payment posting. So you guys know that numbers, math, I like just fantasized me, and I was always good with numbers. And the problem was many people were not good with numbers. Now, 22 years ago was different. So as I'm working, as you guys also know, I'm working on the business book, which does capture this the last 22 years. And when I'm talking about this time, the early 2000s, there is a computer system called DOS-based system. And as I was working with my editor, I had to kind of just go into, like, he didn't understand why we had to kind of elaborate that, because by the time this book would be published, people probably wouldn't really know what DOS-based system is anymore. So like if young people are gonna read the book, hopefully. So then we were kind of explaining. So that time, everything on that EOB, like Delaware Cardiovascular was, and Hospitals of Delaware, 2 clients, I had to punch each of those one by one. 15-page, it would take, like for me, it would take a good 45 to 50 minutes. There was a really nice payment poster working with me, and then it would take literally 2.5 hours. And she would be so stressed, and then and I would go there and help her to reconcile her EOB, and then we would spend another 30 minutes. And it was an extremely stressful work. But then 3 years ago, what was happening, then I forgot how to post money in our system, or maybe 4 years ago, right, JR? So then I asked JR's help to help me to teach me how to post money again in our system. So now, one of the things that I do want to point out is payment posting is equally important for our account receivable side, because if payment posting is not properly done, the AR is not going to work properly. And we do this episode just so that our employees and our clients are watching it as well. And sometimes we, every other week we do clinical stuff, and then this is our kind of business week. And if the clients are watching, they know why this is important. But also our employees need to also understand that payment posting is equivalent to our AR departments in terms of what the work is being done. Because if it's not done correctly, everything else is not happening correctly. So then a reconciliation process is another big part, because we hear in many different practices, in the offices, they do have money issues, meaning that they're not able to reconcile money. Front desk collects the money, and then sometimes they don't match up, and then they don't know where the money is. Well, it didn't go public, so I won't mention the name, but one of our clients outside of Delaware lost about $150,000. And if they were following the guidelines that we built, we structured from the beginning, then that's how system would help, and then good payment posting would also help them as well. But we also expect client to participate in these, and then making sure that they are following our instructions as well. So just wanted to make sure that I wanted to address a couple of those things with you guys. So Dora, we can go back to the video.
thank you, Kemal. So just to touch more on the manual posting aspect that JR had mentioned, we received this form of payment in many different ways. As he mentioned, most commonly via lockbox. And this is a service that's provided by the provider's bank. Ultimately, there is an address listed for that payer, for that provider, and that will be a PO box number that sends the documents directly to the bank. When they receive those, they're going to process those and deposit them into a bank account for the provider. And they create these batches of multiple payments. And then our team will go in to this site and they'll extract those batches of payments and process those in the PM system. We also receive them by physical mail. Some providers, very limited amount of providers will send us things directly to the billing office, as well as electronic fax, which is our most common now. The newest but not so new method that we utilize is Cerner Secure File Transfer. So this is a site that we utilize that's kind of in conjunction with Cerner, where the providers and even our team can go in and upload documents, and then we can extract those and work those in a timely manner. It's just kind of a communication between, the providers and ourselves, and a place to store those documents as well. And then, of course, we receive service requests from both the providers and our accounts receivable team. And those documents are generally payments that they found by working aging, maybe payments that are for payers that we stopped receiving at some point, or just things that JR and I need to work to get enrolled and set up for that electronic connection. And then lastly is, of course, the payer sites. Some payers, there may be instances where those payments, of course, don't come in electronically. Our team will go into sites such as Optum, Availity, MDon, even, the state Medicaid sites, and pull those documents and post them. So the next slide would be just some examples of those different sites that we would utilize. Is actually up on the screen now, claims and payment portals. So you can see Zealous and PaySpan and Instamed. Those are just a few prime examples that we utilize. And I'm just going to talk a little bit about the reporting aspect of what we do. So on a monthly basis, generally the first of the month, we'll go in and we'll extract some reports that are utilized through multiple departments here at UM. And they consist of both aging and production reports. The first report that we generally run are going to be the financial reports. And those are generally used for invoicing for clients. For SPM, those are the practice summary reports. PDS is going to be the production analysis. And then there's multiple other reports that we utilize, such as the capitation verification report and incentive posting reports. Additionally, we pull accounts receivable reports, and those consist of the age receivable manual entry reports. And these reports calculate the dollar amount that is in each aging bucket. So for instance, the aging that is between 61 and 90 days, or total amount of insurance aging, as well as patient balances that are over 121 days. We also will pull the 6-month charges and days in AR report, and that just takes the average of the 6 months and calculates the total aging for that client. And then also JR and I will complete a ERA verification process. So each month we will sit down and we'll go through all of the payments that are received per client, verify that we're receiving ERAs for those big payers like Blue Cross Blue Shield, Medicare, Medicaid, make sure there are no gaps for any time frame, as well as making sure that they're set up for electronic funds. And then we also utilize reports such as the payment and adjustment codes report. So these are reports that our teams will run that will individually extract the data for every single payment and every single adjustment that they post on a daily basis for the previous month. Additionally, JR and I will review, do a documentation verification where we just make sure that everything that we have received, whether that be from the provider, via SR, fax, is accounted for and worked properly and in a timely manner. The next topic that we're going to talk about is benchmarks. So we just wanted to touch a little bit on the benchmarks for our department. The basic requirements for our department for a full-time employee is about $800,000 a month, or about $6,000 per hour. We also utilize, of course, the payment and adjustment codes, which I just mentioned, and that calculates the individual entries for each payment and each adjustment that's entered into the PM system. The minimum requirement for that is about 25,000 codes. And as JR mentioned, we do utilize that whenever we have to make a new client distribution, whether that be because someone's out of the office, something COVID related, we'll utilize that to kind of distribute the money kind of more evenly, kind of make it even across the board. And lastly is our quality. Our quality standard is 90% on our monthly routine audits. So quantity is very important, but quality is even more important. We want to see that high dollar amount posted, but ultimately it needs to be posted correctly. Kemal, as you said, you know, payment posting is essential. It has to be done properly so that everything kind of flows together. And the last topic that we wanted to kind of talk about was TriZetto provider solutions. And this kind of ties into what JR was saying, what he mentioned about the enrollments and what we utilize with this site. So this is another site that's kind of utilized across multiple departments. It's kind of our hub for sending those medical claims, like JR said, and receiving back the payer data for each payer. So they take those claims and they translate it into an electronic format that kind of allows the data to communicate with our PM systems. It communicates, you know, different payer delays, client site issues, when a payer will terminate their electronic claims. And additionally, we utilize it for STEM, and STEM is Strategic Enrollment Manager. And this is a portal that we utilize that encompasses basically all things EDI and ERA enrollments. It provides us with the appropriate documentation and instructions to complete ERA and EDI enrollments, basically all in one site. It's a great place for organization, and it kind of organizes them into different categories, like when the payer is still processing the enrollment or when the enrollment is completed. So ultimately, it allows JR and I to go in, you know, initiate those enrollments, obtain those documents, and complete enrollments efficiently. And that is all.
All right, Dora, very good. And the other thing that I was thinking that what you guys are doing these days, well, not these days, in the last 2 years, you have your management became more, not challenging, but maybe more interesting because you are managing people in 2 different continents, right? In 2 different time zones. Some of your employees are 7 hours, 6 months of the year, and 8 hours, another 6 months of the year. And how is that working out for you guys so far?
I personally love it. I think it's great meeting people, of course, from another part of the world, but their knowledge is amazing. They bring something to the table that's a little bit different in here in the US. So it kind of gives us a challenge, you know. Of course, you know, the language barrier kind of makes you have to use your brain a little bit more when having conversations, but it's great. We have some really great people in our team, and we're very, very glad that they're here.
Good to hear that. All right. Well, Tarrant, so let's have you cover the patient registration and eligibility check, right?
Yes, correct.
So, am I on the right video? I am.
Yep.
All right. Thank you.
I just wanted to discuss the SPM eligibility function that we've been encouraging all of our clients to take advantage of, especially clients who have high claim denial counts related to eligibility due to not having maybe the ability to check each patient's eligibility when they are seen at the front desk. In the first slide, the eligibility function is located within the patient monitor in SPM and is used to automatically verify the eligibility and benefits for patients with appointments that are coming up. The way it is done is the function creates a report of all the appointments submitted for eligibility verification that is then forwarded to our clearinghouse. And then the clearinghouse then sends the file to whatever payer the patient has on file. After it has been sent, the payer sends a response back to SPM. And then once the response is given to SPM, SPM will automatically update the appointment information with the eligibility status. And also individuals can also request eligibility status in real time the day of the appointment as well. And for slide 3, it's just a snippet of the patient monitor where you can see the appointments that are there for the date selected. And the last 2 columns is where the eligibility function is displayed. You can see the type of insurance the patient has and whether a patient's benefits are currently active or not. The next slide also is a screenshot of the eligibility batch status, which shows how many requests were made on a specific day. It shows how many eligibility requests were on the appointment date, as well as how many were verified. The following slide shows the eligibility response report that shows in more detail the type of plan the patient has. You can see their coverage status to health benefits, as well as see how much the patient has in regards to deductible. And I think the last slide is just an example of the filtered eligibility response report that can be retrieved within the patient monitor. It just displays the payer's response and provides more detailed information, such as exactly how much a patient has left to pay towards their deductible. So we believe that this function will definitely benefit all clients and should definitely be looked into. That's all I had.
So I think this report, this function and the report is very similar to the appointment reminders and the text reminders. The challenge is, and sometimes for whatever reason, I see this even in our offices, in the offices that we own, they kind of forget that every day these reports should be checked, because one of the reasons that this report is run every day is because it then tells you the issues. So if the patient doesn't have coverage or if they have different insurances, so this is your time to update those. And you don't want to do it on the day of. You definitely need to do it at least 2 days before, so you have opportunity to fix these and address these issues. But just like everything else, so like I see like appointment reminders, oh, there's an appointment reminder report, great. So then are you guys checking these reports every day? Well, no. Well, then what happens if the system doesn't work, where you are not able to reach out to the patients? Oh, so we don't call them. Well, then you miss out. So same thing for this report. There has to be a designated person, and then they should be joining they should be checking every day, verifying, and then making sure that they don't miss anything. Unfortunately, that's not a common practice. And that's kind of like one of my concerns, and that's why I wanted these things to be covered. Part of this presentation will be trimmed and we'll be sharing for some of our clients directly, and I'm hoping that we can make our point pretty clear. And this was a really nice, clear presentation. Thank you for preparing this, presenting this.